Hi, welcome to today's Talk of the Town. I'm Sandy Benson, back this month with another great topic regarding dental care for our pediatrics and children. Dr. Shane Harpham of Smiles Pediatric Dentistry, a WHHI-TV news partner. Dr. Shane!
How's it going?
Great, how you doing?
Good, great to see you again.
So how are our kids?
The kids are doing great. I have a 7-month-old of my own, so keeping me up. How about that?
That's a lot. That's a lot. So there seems to be a lot of controversy over whether or not children should use fluoride. What are your recommendations?
I get a lot of questions on fluoride, the subject of fluoride. That's why I want to bring up the topic today. Fluoride is commonly found in our community water supplies. It's found in juices, beverages, infant formula. It's found in prepared foods, and it's also in our toothpaste. There is a lot of recent research that confirms, evidence-based research, that shows the use of fluoride is both highly safe and effective in reducing caries or cavities in children.
And how has fluorinated water helped to reduce cavities in children?
Well, optimally concentrated levels of fluoridated water in our community water supplies is the most beneficial and inexpensive method of reducing cavities in children. Since its introduction into the community water supplies in the 1940s, we've seen a reduction of children's cavities of about 25%.
Wow.
But not only reducing the amount of cavities that we're seeing in children, we've also seen a reduction in the oral health care costs of nearly 50%.
Wow, that's huge. So what if a child does not live in an area that provides fluorinated drinking water at home? What are your suggestions or recommendations in that situation?
Well, the American Academy of Pediatric Dentistry recommends that if a child has high dental caries risk and lives in an area maybe with well water or does not have fluoridated water systems at home, that we can provide fluoride supplements. Generally, this would begin after a child's about 6 months or greater.
And how much toothpaste should a young child use if it contains fluoride? Are there limitations? Are there a degree where it becomes dangerous?
Yeah, well, what happens is, first off, we want a child to establish a dental home by the time they're 1 or their first tooth erupts, so we can assess their risk for getting cavities. But what we recommend is, if a child is 2 years of age or under, we recommend just a smear or rice-sized amount of fluoridated toothpaste. And if a child is between the ages of 2 and 6, we can use a pea-sized amount of fluoridated toothpaste. But it's also very important, I want to emphasize, it's very important for the parents to take an active role in brushing their child's teeth, just to make sure they're getting the plaque off and doing a good job brushing.
So what if a child swallows toothpaste with fluoride, and what are some of the symptoms we might see if they actually ingest too much fluoride? There's
always a concern that maybe your child could have too much fluoride. I get that question a lot as well. But that's why we limit, if it's 2 years of age and under, to just a smear amount of toothpaste or a rice-sized amount of toothpaste. Or again, if they're 2 to 6, to just a pea-sized amount. So we can try to limit that way how much fluoride they do get. But if you're concerned that maybe they took the toothpaste and had, had a little bit too much toothpaste, what we can do is we recommend give them some milk and contact your dental professional right away. You would see some nausea, some stomach pains, and again, just give us a call and we will get you in the right direction of where we want to go. And
so what type of fluoride do you use in your office when children are coming in for their cleaning?
Yeah, we use...
I guess I didn't realize there was different...
there's gels, there's foams.
Oh, okay.
We use a what we call a 5% sodium fluoride varnish. It's really sticky, but it's kind of cool because we use just a little, we call it a paintbrush for the kids.
Okay.
And we call the fluoride vitamins. We have different flavors: mint, bubblegum, cookie dough. And what we do is we'd like to dry the teeth off, and we just kind of paint it on the teeth so the child's not really swallowing a ton of it. Again, it really helps in reducing cavities. I have a lot of parents that may not want it, and that's okay. I just want to express the benefits of fluoride and educate them. And if they elect not to have the fluoride, we honor their parents' wishes.
So would that varnish, would that seal the teeth?
It doesn't seal, it just kind of coats the teeth.
Okay.
And we recommend that the child doesn't eat or drink for, at least 30 minutes to an hour. The longer the fluoride is on the teeth, the longer it has the ability to be effective in controlling and preventing cavities and making the teeth stronger.
So you want to give us an idea of what we'll be talking about next month?
Next month is going to be, I have a little bit of a surprise.
Oh, good.
So I don't want to go into too much detail.
Yeah, well then we won't ruin the surprise.
Yeah, and I had a lot of people ask me about fluoride, so that's why we wanted to bring it up this week.
Good, well, all good information, and Dr. Shane, always a pleasure to have you.
It's great to be here. Thank you so much.
Thank you. And we'll be right back with Talk of the Town.